She was 23 years old the first time she kept a man alive with her bare hands in the dark, in the dirt, with nothing but a tourniquet and the sound of incoming fire. No hospital, no attending physician, no one to call for backup, just her hands, his blood, and the decision she had to make in the next 4 seconds, or he wasn't going home. That was 8 years ago. Now Olivia Hayes was standing in the break room of Riverbend Regional Hospital in Ashport, Georgia, eating a granola bar she didn't want because she'd skipped lunch again, listening to two senior nurses argue about the new scheduling software and wondering if this was what the rest of her life looked like. She didn't know that in 7 days, everything was going to crack open. Before you find out what happened when those ER doors blew apart, follow along, hit like, and drop your city in the comments. I want to see exactly how far this story travels. The first week at Riverbend wasn't cruel. It was something quieter and more grinding than that. It was indifferent. Nobody yelled at Olivia. Nobody had to. The senior staff had a way of making a new hire feel invisible without lifting a finger, a kind of ambient dismissal that settled over everything like humidity. You felt it in the way a charge nurse didn't finish her sentence when Olivia walked in. You felt it in the way Dr. Elliot Marsh, the lead emergency physician, glanced at her badge, then away, then didn't look back. She was 31. She looked younger than that. She was quiet in a way that people mistook for uncertainty, and she moved through the ER with a kind of economy of motion that most people didn't notice, but that meant she was always 3 steps ahead of whatever was happening. Nobody clocked it. They were too busy deciding she was out of her depth. The hospital was mid-sized, perpetually understaffed, and proud of itself in the way that institutions are when they've survived long enough to mistake longevity for excellence. Riverbend Regional had a Level 3 trauma designation, which meant it handled serious emergencies but transferred the catastrophic ones to Augusta. The ER ran on controlled chaos, not battlefield chaos, Olivia noted privately, but the kind that felt dramatic to people who'd never seen the other kind. Her supervisor was Donna Reyes, a charge nurse with 19 years on the floor and a way of assigning tasks that made you feel like you were being tested even when you weren't. Donna wasn't mean, she was efficient, and efficiency didn't leave much room for warmth. She'd handed Olivia her orientation packet on day 1 and said, "The first 3 months, you watch more than you do. That's not a suggestion." Olivia had nodded. She was good at nodding. What Donna didn't know, what none of them knew, was that the woman standing in front of her had spent 4 years as a combat medic attached to a ranger battalion, and a further 2 embedded with a joint special operations task force in environments that didn't have names on maps civilians could access. She had treated blast injuries, sucking chest wounds, arterial bleeds, and traumatic amputations in conditions ranging from 110-degree heat to high-altitude cold that made your fingers stop working right. She had been in 3 firefights as a non-combatant and 1 as something more than that, though she never talked about that last part. She had left the military quietly, the way she did most things. She'd earned her civilian nursing credentials, done her transition program, and applied to Riverbend because it was 2 hours from where her younger brother was finishing his last year of high school, and she wanted to be close to something that felt like home, even if she wasn't entirely sure she remembered how to do that. She had not put her full service record on her resume. She'd listed her medical training and left the operational context vague. It wasn't deception, exactly. It was more that she'd learned, the hard way, more than once, that telling people you'd spent years in active war zones didn't make them trust you faster. It made them uncomfortable. It made them ask questions she didn't want to answer in a job interview. So she'd kept it simple. And now she was the new hire who ate granola bars alone and let people assume she was a little slow to warm up. It was Monday of her second week when the first real thing happened. She was assigned to triage alongside a second-year nurse named Priya Sood, who was helpful and quick and had the nervous energy of someone who cared deeply about doing everything right. They were processing a steady but manageable flow, a dislocated shoulder from a weekend pickup basketball game, a kid with an asthma flare, an elderly man with chest pressure that turned out to be rib pain from sneezing, when a patient came in presenting signs of sepsis that Olivia caught before the triage screen did. "His pressure is dropping and his temp's been climbing for 6 hours, Olivia said, flagging Priya. "He needs blood cultures and a lactate before anyone starts him on fluids." Priya hesitated. "I'll put it in the system and Dr. Marsh can—" "He needs it now." Olivia said it without any heat in her voice. Not after the cue. She turned out to be right, which didn't make her popular. The patient was septic, and the faster intervention made a difference. Doctor. Marsh acknowledged it in the most minimal possible way, which was to not say anything at all, which in hospital culture was its own kind of recognition. But Donna Reyes had heard the exchange, and after the shift, she stopped Olivia near the locker room. You want to be careful about overstepping, Donna said. She wasn't threatening, she was matter of fact. Doesn't matter if you're right if you do it the wrong way. I understand, Olivia said. Do you? Yes. Donna studied her for a moment. Where'd you work before this? Mobile units, deployable settings. It was true. Technically. Mobile units. Donna repeated it like she was turning it over, looking for the catch. Well, we do things in a particular order here. Learn the order. I'm learning, Olivia said, and left it at that. The rest of the week passed in variations on that exchange. She made 2 more calls that turned out to be correct and 1 that turned out to be premature. Which doctor? Marsh noted with the kind of measured patience that felt more like scoring a point than correcting a mistake. A hospitalist named Dr. Carla Nguyen was kinder about it. She pulled Olivia aside after rounds and said, You think fast, which is good, but you need to let people see your reasoning or they'll think you're guessing. It was the most useful thing anyone said to her all week, and she carried it. She had Thursday off and spent it driving back roads outside Ashport because she didn't sleep well in unfamiliar spaces, and motion helped. She'd been doing that since she got back, driving, walking, keeping her hands busy, and she'd mostly stopped needing to know why. Friday morning she came in early, as she usually did, and found Priya already at the station looking frayed. 3 traumas before 7, Priya said by way of greeting, and the on-call attending called in. Who's covering? Marsh. He's been here since yesterday. Priya lowered her voice. He's in a mood. That was a polite way to put it. Dr. Elliot Marsh, at the end of a double, was a version of himself that filed off whatever small social consideration he maintained under normal conditions. He was competent, she'd give him that, but competence at cost. He barked orders, dismissed questions, and had a way of looking at a nurse like she was a piece of equipment he was evaluating for replacement. The morning ground forward. Olivia worked a pair of back-to-back lacerations, assisted on a pediatric fracture, and was halfway through restocking a supply cart when she became aware of a shift in the ambient noise of the ER, a change in the quality of the sound that she registered before she could articulate why. It was the automatic doors at the main entrance. They didn't open. They slammed apart like a pressure wave, both panels hitting their stops at the same moment with a sound like a clap of thunder, and 3 men in Marine Corps utility uniforms came through them moving fast. 2 were carrying a third between them. A large man in his late 60s, face the color of old concrete, eyes half closed. The man they were carrying wore civilian clothes but had the bearing of military command even while unconscious. Something in the set of his jaw, the way his body didn't go completely slack even in crisis. And behind them, on a short lead that one of the Marines was barely controlling, was a German shepherd in a tactical vest who was actively blocking anyone from getting within arm's reach of the man being carried. The dog wasn't barking. It was quieter than that, and somehow worse for it. It was placing its body between the carried man and every person who approached, head low, making a sound in its chest that stopped people before they got close enough to understand why they'd stopped. Donna Reyes was there in 12 seconds. Bay 3 now. What happened? General Marcus Whitaker, retired, one of the Marines said. He was the one holding the lead, a young sergeant with blood on his sleeve that might have been his or the general's. Collapsed 40 minutes ago, chest pain, unresponsive on and off since the car. He's got cardiac history. The dog has to go, Donna said. She doesn't go, the sergeant said. He wasn't threatening. He was stating a fact. Her name is Vega. She's the general's dog. She goes where he goes. Dr. Marsh appeared at Donna's shoulder and took in the tableau with the expression of a man encountering a logistics problem. We can't work around a dog. Then we'll take him somewhere else, the second Marine said, and he clearly meant it. No, Marsh said. Bay 3. They moved, and Vega moved with them, and every time a nurse or tech tried to get close to the stretcher to hook up monitoring, the dog shifted and the person stopped. Not because they were afraid, exactly, because something about the animal's absolute certainty made you hesitate. Olivia had been watching from the doorway of the supply corridor. She hadn't moved toward the commotion the way the other staff had because she had been watching the dog, and she was putting things together in a way she wouldn't have been able to explain in the moment. The vest, the way the animal moved. Not aggression, protection. The particular posture that said, "This person is mine and mine alone." She knew that posture. She'd seen it in FOBs and field stations, and once in a case-vac aircraft over terrain, she still saw sometimes when she closed her eyes. She set down the supplies and walked toward Bay 3. Dr. Marsh was trying to get close enough to assess the general's airway, and Vega was making it impossible. The sergeant was pulling on the lead and talking low to the dog, but Vega wasn't listening to him because Vega was in protective mode, and a dog in protective mode doesn't take orders from peripheral handlers. It takes them from the one person it trusts, or it doesn't take them at all. "Clear a path," Marsh said. "Somebody call security." "Don't," Olivia said. Every head turned. She was already moving past the outer ring of staff into the bay. Not fast, not with any drama, just steady and direct, and she kept her eyes on Vega the whole time. The dog's head swung toward her. The deep chest sound stopped. Not because Olivia raised her hand or made a gesture, but because she said quietly, and with the particular flatness of a command delivered in a specific context, 2 words. "Raven 6. Vega sat down. The bay went completely silent. The sergeant stared at her. Marsh stared at her. Donna Reyes stared at her. The dog was looking at Olivia with an alertness that wasn't aggression anymore. It was recognition, the animal version of it, older and more certain than the humankind. "Down," Olivia added, and Vega shifted from sit to down without a sound. "How did you—" the sergeant started. "Later," she said, because General Whitaker was conscious enough now to be gripping the side rail of the stretcher, and his color was still wrong, and there wasn't time. She looked at Marsh. "He's yours. Go." It was the right thing to say. It gave Marsh back the center of the room, which he needed if he was going to function, and she moved to the periphery and let the work start. She wasn't supposed to be in Bay 3. She was a floor nurse, not an ER trauma nurse, and Donna would have something to say about it later. But she was there now, and she watched. Monitoring went on. The paramedic read the field vitals: BP low, pulse ox acceptable, rhythm sinus tachycardic on the field monitor. Marsh was listening to the general's chest, going through the systematic check with the efficiency of someone who'd done it 10,000 times, and the team moved around him in the choreography of practiced emergency response. Olivia stood against the wall and watched the general breathe, and something was bothering her. Not something she could name immediately. A sense. The particular wrongness of a pattern that wasn't quite adding up. She had felt it before, in places where the feeling had to be trusted because there wasn't time to wait for the evidence to stack up cleanly. She stood still and she let the feeling take shape, the breathing. On the right side, something was not absent, not quite, but less. Subtly, fractionally less than the left. And the position the general's body kept defaulting to, the small unconscious shift away from one side that he'd probably been doing for 20 minutes while everyone was focused on his cardiac history. Marsh called for a stat EKG and IV access, and someone was already running for the crash cart as a precaution, and everything they were doing was reasonable and correct for the presenting picture. Olivia walked to the other side of the bay. Dr. Marsh. He didn't look up. Not now. His breath sounds on the right are diminished. I heard them. Did you hear the tracheal shift? That made him look up. She kept her voice even. Left of midline. Subtle, but it's there. And his neck veins. She was already at the general's right side. Not touching. Not overstepping. Just putting herself where he could see what she was pointing at. The distension is asymmetric. Marsh set down his clipboard. He looked at the general again, and something in his face shifted. Not acknowledgement, not yet, but the particular suspension of certainty that comes when a pattern you were sure of suddenly has an anomaly in it. What are you suggesting? he asked. His voice was controlled. Tension pneumothorax building. Cardiac history is real, but it's not what's killing him right now. The sergeant was on his feet. What does that mean? It means air is trapped in the chest cavity where it shouldn't be, Olivia said, and it's collapsing his right lung and starting to push his heart out of position. Marsh stared at her. The clock on the wall counted off 2 seconds that felt much longer than that. Listen again, Olivia said. She wasn't asking. He picked up his stethoscope. The room waited. He moved the chest piece slowly, right side, 4 positions, and when he came to the third one, his face changed in a way that had nothing to do with professional composure. He looked up at her and she could see it. The recognition that something he'd been about to miss was right there, and had been right there the whole time. Get me a large bore needle, he said. His voice was level. 14 gauge, and get cardiothoracic on the phone. The room shifted gear in the way that rooms shift when the real emergency names itself. Olivia stepped back. Vega was still on the floor against the wall, watching the general, watching Olivia, watching the space between them with the patient focus of an animal that has decided something important about a person and filed it away where it stays. The next 40 minutes were controlled velocity, needle decompression to release the trapped air, the general's blood pressure stabilizing within minutes, the cardiothoracic surgeon arriving and ordering a chest tube insertion before any talk of surgery. The general came back to something like consciousness, not full alertness, but present enough to grip the sergeant's hand when it was offered. Marsh ran the bay. He ran it well, and Olivia let him, because that was correct, and because the general was going to survive, and that was the only thing that mattered. Priya found her in the corridor 20 minutes later, eyes wide. That was you in there? Marsh ran the trauma. You called the pneumothorax. Priya was not whispering. Everybody's saying you called it, and he almost missed it. He caught it, Olivia said. That's what matters. Olivia, that's the second time in 2 weeks you've caught something before anyone else. How are you doing that? Olivia looked at her for a moment, then looked away. Down the corridor, through the window of Bay 3, she could see Vega lying with her head on her paws, her eyes on General Whitaker's chest, watching it rise and fall. Practice, she said. She went to find the supply cart she'd abandoned, and she finished restocking it because the work didn't stop, and the day didn't stop, and that was something she understood better than most things. Behind her, through the walls of the ER and the sound of the hospital doing what hospitals do, she could hear Donna Reyes' voice asking where she'd gone, and she could hear Priya saying something in response, and she could hear Dr. Marsh's voice saying something else, something she couldn't make out. She restocked the cart. She cataloged the supplies. She noted a shortage in the gauze stock and wrote it on the replenishment form in the careful handwriting she'd trained herself back into after years of writing under conditions where careful wasn't possible. She was a floor nurse at Riverbend Regional Hospital in Ashport, Georgia. She was 31 years old. She had just kept a retired general alive in a trauma bay while his combat dog held still and watched. And at the other end of the corridor, in the office that looked out over the parking lot, the hospital's director of operations, a man named Gordon Hale, was standing at his window watching the 2 military vehicles in the visitor lot and already reaching for his phone. Gordon Hale made 3 phone calls before noon. Olivia didn't know that yet. She was still in the supply corridor finishing her restock when Donna Reyes found her, and Donna's face had the particular set of someone who had just been told something they didn't like and was working out what to do with it. Dr. Marsh wants to see you, Donna said. Now? When you're done. Donna paused. Don't take too long. It wasn't a reprimand. Not exactly. But it wasn't neutral either, and Olivia noted the tone the same way she had once noted the particular sound a vehicle made when the road changed from dirt to something harder. Small signals, ahead of information, that told you the ground was shifting. She finished the form, capped the pen, and went. Marsh was in the physician's workroom off the main ER corridor, a narrow room with 2 desks and a whiteboard that always had someone's half-erased differential on it. He was standing when she came in, which meant he'd been pacing, which meant whatever was in him right now wasn't entirely settled. Close the door, he said. She did. Where did you train? He asked. No preamble? University of South Alabama, nursing program. Before that. She looked at him. Mobile medical units, deployable environments. That's not an answer. He crossed his arms, not hostile, but not soft either. The code you used on the dog, the field assessment you ran in that bay, those aren't things you learn in a civilian nursing program. They're not things you learn on a mobile unit either, whatever that means. Olivia said nothing. I'm not asking to make trouble, Marsh said, and she thought he probably meant it. I'm asking because you caught something I was moving past, and I want to understand where that came from. The general is alive in part because of what you saw. I'd like to know what I'm dealing with. It was, she thought, the most direct thing he'd said to her since she started. I have field medical experience, she said. Combat environments. I spent several years attached to military units and active theaters. The room was quiet for a moment. Why isn't that on your file? Because it's not required on a civilian nursing application. My credentials are current. My licensure is current. That's not... He stopped. Started again. That's not what I meant. I'm not questioning your credentials. What are you questioning? He looked at her for a moment that went a beat longer than it needed to. The dog. The command you gave it. I worked in environments where military working dogs were part of the operational structure. You learned the commands. And the two-word code. She'd been waiting for that one. Units use specific control phrases. Raven 6 was that dog's designation. The command is registered to a protocol, not a person. She responded to the protocol. How did you know her designation? Her vest, Olivia said. It was marked. Which was partly true. The designation was there if you knew where to look. And she had known where to look because she had done this before, with dogs in vests in situations with higher stakes than a hospital bay. And the knowing wasn't the kind of knowing that came from reading a manual. Marsh uncrossed his arms. He was tired. She could see it now, the end of double shift hollow behind his eyes. He sat down in the chair at the near desk, and for a moment he was just a man who'd been awake too long. You're going to have to talk to administration, he said. Hale's office called while we were still running the trauma. They want a debriefing. About the general? About you. She heard that land in her chest, the way things land when you've been expecting them without wanting to admit it. I'll be there, she said. She went back to the floor and finished her shift. She was good at that. Finishing things. Compartmentalizing. It wasn't a skill she was particularly proud of, but it had kept her functional in environments where falling apart wasn't an option, and she'd carried it home the way you carry things you relied on too long, quietly, and without examining them too closely. Priya caught her at the end of the hall near 6 o'clock, when the afternoon shift was taking over, and the ER was in that brief lull before the evening volume picked up. Did you hear? Priya kept her voice down. The general is stable. They're saying he goes to the ICU overnight and then probably a step down tomorrow. His cardiac workup is clean. It was the pneumo, after all. Good. Olivia. Priya grabbed her arm, not hard, just enough. People are talking. The nurses, the techs. Everybody saw what happened in that bay. Everybody knows what you called. Marsh made the call. After you told him to listen again. Olivia pulled her arm free gently. That's how medicine is supposed to work. Somebody sees something, they flag it, the attending confirms. That's the process. Priya looked at her with the expression of someone watching another person refuse to acknowledge the obvious. Why don't you ever just take credit for something? It was a question that deserved an honest answer, and the honest answer was complicated and involved 8 years of a professional culture where individual credit was the kind of thing that got people in trouble, where the mission was the unit and the unit was the mission, and you checked your ego, the same place you checked your personal items before an operation. But that wasn't an answer she was going to give in a hospital corridor, so she said, I'll see you tomorrow, and went to get her bag. The night was warm and the parking lot smelled like hot asphalt and cut grass from the median, and she sat in her car for 4 minutes before starting it, not thinking exactly, settling. In Bay 3, before she'd left, she'd looked through the window one more time. General Whitaker was on oxygen, monitoring leads trailing from his chest, eyes closed but color better now. A living pink instead of the gray he'd been when they brought him in. Vega was lying on the floor beside the bed, not allowed up, not trying to get up, just present, and one of the Marines, The young sergeant was sitting in the visitor's chair with his elbows on his knees and his hands together and his head bowed. She drove home and made food she didn't taste and was asleep before 10, which was earlier than she'd managed since arriving in Ashport, and she didn't remember dreaming. Gordon Hale's office occupied the northeast corner of the administrative wing, which meant it had 2 windows and a view of the landscaped entrance and a small parking area reserved for senior staff. The office was done in the careful, neutral tones of someone who'd read something about projecting authority without aggression. Cream walls, dark wood desk, a shelf of binders that were probably decorative at this point. Hale himself was 61, silver-haired, with the settled posture of a man who'd spent decades learning how to appear calm while running calculations. He was not alone when Olivia arrived at 9 the following morning. Beside him sat a woman she didn't recognize, early 50s, reading glasses perched on her nose, a yellow legal pad on her knee. And at the end of the small conference table sat a man she did recognize, though not from the hospital. He wore a suit, no tie, and had the compact build and alert stillness of someone with a military background who'd transitioned to something adjacent. "Ms. Hayes," Hale said, "thank you for coming in. Please sit." She sat. "This is Renata Foss, our Director of Risk Management," he said, nodding to the woman with the legal pad. "And this is Wayne Decker. He's a consultant who works with our board on compliance and external relations." She looked at Decker. He looked at her. Neither of them said anything for a moment. "We wanted to talk about yesterday's incident," Hale began, "specifically your involvement in the Whitaker case." "Of course," Olivia said. "Can you walk us through what happened? From your perspective." She did. Calmly, sequentially, without editorializing. She described observing the incoming trauma, the dog's behavior, the command that settled the animal, her positioning in the bay, and the assessment she'd communicated to Dr. Marsh. She left nothing out and added nothing. It took 4 minutes. Foss had been writing the entire time. She hadn't looked up. Hale listened with the expression of a man waiting for the part that concerned him. When Olivia finished, he was quiet for a moment. "The military command phrase," he said. "Where did you learn that?" "I explained this to Dr. Marsh. The designation was on the dog's vest. The command phrase is part of a field protocol." "But you have military training." "I have field medical experience, yes." "That's not on your employment file." "My employment file contains my nursing credentials and my work history. The application doesn't require a full service record." Foss looked up from her legal pad for the first time. "We're not suggesting there's anything improper about your credentials. What we're trying to understand is there's a gap between what's in your file and what apparently transpired yesterday." "My credentials and clinical judgment are what transpired yesterday," Olivia said. "I noticed a patient developing tension pneumothorax, and I communicated that to the attending physician. He confirmed and treated. That's within my scope." "The diagnosis?" "I didn't diagnose. I flagged a clinical concern. Dr. Marsh confirmed." Decker spoke for the first time. His voice was measured and quiet. "Ms. Hayes, General Whitaker is a significant figure. His presence here has attracted attention from people who take an interest in how he's cared for. We want to make sure we understand the full picture before those conversations get complicated." "What conversations?" He didn't answer that directly. "Were you previously known to the general or to anyone in his party?" She paused. "No." "The dog responded to a command you gave, a specific command, not a general one. As I explained." "We heard your explanation," Foss said, and her voice was neutral in the practiced way of someone who uses neutrality as a tool. "We're simply noting that the explanation doesn't fully account for the specificity. A vest marking doesn't typically tell you the animal's full designation protocol." Olivia looked at her, then at Hale, then at Decker. She understood what was happening in this room. Not the details, she didn't have those yet, but the shape of it. These weren't people trying to understand what happened yesterday. These were people managing something, and she was in the way of that management. "What is it you're actually concerned about?" she asked. Hale shifted. "Ms. Hayes, we want to make sure that any staff member who has information relevant to a patient's treatment has disclosed that information appropriately. I disclosed everything to Dr. Marsh. Before or after the fact. During, in real time, as required. And your military background is not relevant to the question of whether I correctly flagged a clinical concern. The room was quiet. Boss's pen had stopped moving. We may need to review your employment documentation more thoroughly, Hale said. In the meantime, we'd ask you to limit your direct involvement in the Whitaker case to what's within your assigned role. My assigned role is floor nurse. I haven't exceeded it. You were in a trauma bay you weren't assigned to, Foss said. I was there because I could settle the dog and allow treatment to proceed. If I hadn't been, your attending physician would have been working around an uncontrolled military working dog or waiting for security to remove an animal that wasn't going to be removed. That may be true, Hale said. But going forward, we'd ask you to remain within your assigned station. She stood up. Is that all? A beat. For now, Hale said. She left the office and walked down the corridor and did not stop moving until she reached the stairwell at the far end of the administrative wing, where she pushed through the door and stood in the concrete quiet and took 2 deliberate breaths. She was not afraid. That was important to acknowledge because the flutter in her chest could have been mistaken for it. It wasn't. It was something more like recognition, the particular feeling of understanding that the ground you thought you were on is different from the ground you're actually standing on, and that adjustments need to be made. She had been here before. Not in this building, not in this configuration, but in rooms where people with institutional authority are deciding what shape a problem has, and where the problem, in their formulation, is you. She went back to work. The general was moved to the ICU early that afternoon. Vega went with him, which required a written accommodation from the sergeant, whose name, Olivia learned from Priya, was Sergeant Dale Rourke, citing the animal's status as a registered PTSD service animal, a designation that superseded standard hospital animal policy. The ICU charge nurse apparently argued about it for 20 minutes and then backed down. Olivia had 2 scheduled patients that afternoon, both routine, and she performed them routinely, and she was professional and thorough, and she noted her findings, and she documented everything, because she had understood since the morning that documentation was now armor. At 4:30, Priya found her again. Priya had a quality of appearing exactly when Olivia had stopped looking for company that might have been coincidence and might have been Priya being more perceptive than she looked. Rourke was asking about you, Priya said. The sergeant, the one with the general. Olivia paused her charting. What did he ask? Just who you were, your name, whether you worked the ICU floor. Priya paused. I told him your name. I hope that's okay. Fine. He seemed not alarmed exactly, more like he was trying to place something. Olivia turned back to her screen. He knows you, Priya said. Doesn't he? It wasn't quite a question. Olivia didn't answer it like one. I don't know him. But he knows you. She finished the line she was charting and saved it. Priya? Yeah? How are your notes from yesterday? Priya blinked at the change of subject. My notes? Your shift notes. What you documented about the incoming trauma. Normal. Standard. Why? Just make sure they're accurate and complete. All of them. Whatever you observed in that bay. She looked at Priya. Not because anything's wrong, just because complete documentation is always a good idea. Priya stared at her. She was smart, Priya. Smart enough to understand that advice given for no apparent reason usually has a reason. Okay, she said slowly. Yeah, okay. That evening, before her shift ended, Olivia received a message through the hospital internal system. It was from Hale's office, brief and formal, requesting her presence the following morning for a follow-up meeting. The message used the phrase administrative review, which was a different and more formal construction than the word discussion that had been used the day before. She read it twice, forwarded it to her personal email, signed out of the system. On her way through the main lobby, she passed the hallway that led to the ICU wing, and she stopped at the junction for a moment, just a moment, and then kept walking. She got the call at 6:47 in the morning. Her phone was on the nightstand, and the sound pulled her from a dreamless sleep, and she had it in her hand before she was fully upright, the way you answer calls when calls have historically meant things happening in the dark. It was an Ashport number she didn't recognize. Ms. Hayes, a man's voice, not Hale, not Marsh, calm and deliberate. This is Sergeant Rourke. I'm sorry to call this early. She was sitting on the edge of the bed now. How did you get this number? Hospital directory. They list staff contact information for emergency coordination. I'm sorry. I should have started differently. A pause. I need to talk to you about the general, about what you did yesterday. I should be clear that I can't discuss patient information. I'm not asking about patient information. I'm asking about something else. Another pause. Longer. Ma'am, the general woke up last night, around 2 in the morning. His first coherent request was to know who called the chest injury. The ICU nurse told him she didn't know. He asked again this morning. His second request. There was something in Rourke's voice that he was keeping very flat. He also asked about Vega. And Vega, when he asked, she turned and looked at the door. Olivia said nothing. I know what Raven 6 means, Rourke said. It's not a public designation. It's not on the vest. I checked the vest after yesterday, and it's not there. He waited. Who are you? She stood up, walked to the window. Outside, the Ashport morning was doing what southern mornings do. The light still thin and slanted, the air already carrying the weight of the coming heat. I'm a nurse at Riverbend Regional Hospital, she said. That's not what I asked. She watched a car pull out of the apartment complex across the street. A woman walking a dog, small and pale, nothing like Vega. I served, she said finally. That's enough. What unit? That's not... She stopped herself. I was attached to several units over time. I learned the protocols. That's all I can give you. Rourke was quiet for long enough that she thought the call might have dropped. Then, the general's going to want to thank you. He doesn't need to. He'll want to anyway. A beat. I think you should know something. There are people at that hospital, people above the clinical staff, who were asking questions about you last night. Not through normal channels, through someone on the board. She turned away from the window. What kind of questions? The kind that aren't about your performance. He stopped. I don't know the full picture, but I know what it looks like when someone's trying to build a file on another person. I've seen it happen to people I care about, and I'm not going to watch it happen and say nothing. She thought about Hale's office, Foss's legal pad, Decker and his quiet suit and his careful eyes. Thank you, she said. Don't thank me yet. His voice dropped slightly. There's something else. The general's cardiologist this morning ran a full panel. He confirmed the tension pneumo was the acute event, but he also noted something in the general's chart, a previous hospitalization 6 months ago at a different facility. He paused again, and this pause had a different quality, careful, measured, like he was deciding how much to hand her. The discharge notes from that hospitalization are incomplete. Specifically, there's a gap in the documentation of the presenting injury, and the cardiologist this morning said the pattern of the injury yesterday was, in his words, consistent with something that has been slowly developing for some time, possibly untreated or undertreated. Olivia was very still. I'm telling you this, Rourke said, because the people asking questions about you are the same people who have a relationship with that previous facility. And I don't know what that means yet, but I think you should. She was already thinking about Decker, about the phrase external relations, about the way Hale had looked at her across that cream-colored desk. What's the name of the other facility? She asked. Rourke told her. She wrote it on the notepad she kept by the bed, the one she'd started keeping there 2 weeks into the job because the habit was older than the job. The name was a hospital she'd never heard of, which meant it was either small or private or both. Be careful today, Rourke said. Whatever that meeting is about this morning. She looked at the notepad, at the name on it. I'm always careful, she said, and meant it, and hung up. The meeting was not in Hale's office this time. It was in the second-floor conference room that the hospital used for board presentations, a room with a long oval table and 8 chairs and a projector screen that was mercifully off. Hale was there, and Foss, and Decker, and 2 people she didn't recognize, a man in his 50s with a bearing she'd classify as legal, and a woman who introduced herself as Dr. Patricia Kellner Chief Medical Officer. Kellner she'd heard of, but never met. The CMO worked at an altitude above the floor, and her presence here in a room that had been billed as an administrative follow-up was its own kind of information. "Thank you for coming," Hale said. She sat down. Kellner opened. She had the manner of someone who ran complex things and was accustomed to being the most prepared person in any given room. "Ms. Hayes, we want to have a candid conversation today. What happened 2 days ago with General Whitaker's admission was unusual, and it's drawn attention from several directions." "I understand," Olivia said. "We've done some additional research into your background. We accessed your licensing records, your academic transcript, and the employment history you provided at application." She paused. "There are years unaccounted for. Between my military service and my nursing program, I did contract work in medical logistics. It's not required on a civilian employment form." "Military service," Kellner said, and there it was, named explicitly for the first time in an official setting. "You've been describing your background as field experience in deployable environments. That's quite different from active military service." "They're not mutually exclusive." "What branch?" the legal man asked. He'd introduced himself as a name she'd already forgotten, something ending in son. "Army." "Rank?" "Sergeant First Class at discharge." "And your role?" "Medical." "Specifically?" She looked at him. "Combat medic, special operations support." The room had a brief silence that she'd come to understand was the particular silence of people recalibrating. "Ms. Hayes," Hale said, "why was this not disclosed at application?" "Because it wasn't asked for in the application. I provided my nursing license, my certifications, and my work history as required. Nothing in the application asked for military MOS or operational assignment. Standard applications ask for prior employment. Military service isn't employment, it's service. It appears in my background check as an honorable discharge, and that's where it is." Voss was writing again. Kellner folded her hands on the table. "We're not questioning your right to privacy regarding your service. What we're questioning is whether your actions in the ER were within the appropriate scope of your role here." "I've answered that question." "You've answered a version of it," the legal man said. "The question we have is whether a nurse who deliberately obscured significant medical expertise obtained in a different context is operating transparently within our institutional framework." Olivia looked at him for a long moment. "I didn't obscure anything. I met the application requirements. My clinical actions were within scope. I flagged a clinical concern to an attending physician who confirmed it." She kept her voice even. Not flat, even. There was a difference. Flat was suppression. Even was control. "The patient is alive. That's the outcome of the actions under review." "The patient being alive," Decker said, and this was the first time he'd spoken, and everyone in the room felt it slightly shift, "doesn't automatically validate every decision made on the path to that outcome." She looked at him. He had a quality she'd seen before in certain kinds of men, the quality of someone who operated slightly outside the visible structure of any given room, someone who had arrived through a side door and was comfortable staying near it. "What does validate a decision?" she asked. "Transparency," he said. "Appropriate disclosure. Institutional trust. And saving a man's life." "And saving a man's life," he agreed, as if he were agreeing with something reasonable but ultimately secondary. She understood then, with the particular clarity that comes when you've been reading signals long enough to stop needing to see the whole pattern, that this meeting was not about her nursing practice. It was about something else, and she was either a problem to be managed or a variable to be removed from the equation, and the people in this room had not yet decided which. The legal man slid a document across the table. "We'd like you to review and sign this," he said. She picked it up. 2 pages. Dense language. It was a statement affirming that she would not discuss her observations, assessments, or any information related to General Whitaker's admission with outside parties, and that her testimony in any legal or administrative proceeding related to the General's care would be subject to hospital review prior to delivery. She set it down. "I'm not going to sign this," she said. Hale leaned forward. "Ms. Hayes, no." She said it the same way she said everything, without heat, without emphasis, just a word with a meaning. This document constrains my ability to testify accurately in a legal proceeding and requires prior hospital approval of my medical observations. I'm not signing it. It's standard procedure for patient privacy. It's not. She picked it up again and turned it over. Patient privacy is covered by existing federal law. This is an institutional confidentiality requirement that goes beyond that and specifically applies to my professional testimony. She set it back down. I'd need to speak with my own counsel before signing anything like this, which I won't have had the opportunity to do since I received no notice that a document would be presented today. The room was quiet again. Different quality this time. Kellner looked at Hale. Something passed between them that Olivia couldn't read precisely, but could read approximately. Ms. Hayes, Kellner said, I want to be clear that we have significant concerns about how this situation has developed. Your clinical involvement in the Whitaker case has created complications that the hospital now has to manage. Given the lack of full transparency regarding your background and the questions around scope of practice, we feel it's appropriate to place you on administrative leave while we conduct a thorough review. The words were careful, bureaucratic. She'd heard the shape of them before, in different contexts, when the decision had already been made and the language was being managed to make the decision look like a conclusion. Paid leave, she said. Paid administrative leave, yes. Pending the outcome of the review. What's the timeline? We'll move as quickly as is appropriate, Kellner said, which meant no timeline, which meant however long they needed. She stood. She picked up the document, their copy, the one that was unsigned, and she set it in front of the legal man with the tips of her fingers. I'll expect written notice of the leave and the specific grounds by end of business today, she said. My personnel file should note that I declined to sign the document and that I was not provided advance notice of its existence. Foss stopped writing. Of course, Hale said. She walked out of the conference room, down the corridor, past the nursing station where Priya was at the desk, and looked up and saw something in Olivia's face and put her pen down. Past the Bay 3 door, which was now empty and clean, the patient long since moved upstairs. Past the main desk, where the morning shift was already deep in the rhythm of the day. Through the ER doors, not the slammed-apart ones from 2 days ago, the regular ones, the ones that opened with a mechanical sigh and let in a ribbon of Georgia morning, and out into the parking lot. She stood beside her car for a moment. The sky was a hard and honest blue. Her phone buzzed. Unknown number, local area code. She answered. Ms. Hayes? Not Rourke this time. Older voice. Rougher, still carrying the residue of a man who'd spent years talking to people through noise and distance and difficulty. This is Marcus Whitaker. I understand you're the one who kept me breathing. She closed her eyes for 1 second. General, she said, you should be resting. I've rested enough. His voice was stronger than it should have been for a man 2 days out of a tension pneumothorax. I also understand you just walked out of a meeting that didn't go well for you. She opened her eyes. The parking lot, the blue sky, the hard geometry of a morning that had not gone the way she'd planned. How do you know that? She asked. Because I've been making some calls of my own, the general said. And because Wayne Decker's name came up, and I know what Wayne Decker does and who he does it for. She was very still. I think, he said, that you and I need to have a conversation. And I think we need to have it before they figure out that I'm already 3 steps ahead of whatever they're trying to manage. In the ICU on the 4th floor, through 2 sets of secured doors and a hallway she wasn't currently authorized to access, a man who had survived 4 deployments, a Senate confirmation, and now a collapsing lung was sitting up in his hospital bed with a phone to his ear and a combat dog alert at his feet, and a look on his face that the nurses on his floor would later describe, in their notes, as determined. And in her car in the parking lot, Olivia Hayes started the engine. She didn't go back inside. She sat in the car with the engine running and the air conditioning doing nothing yet, and Whitaker's words still in her ear, and she made a decision the way she'd always made decisions under pressure. Not by weighing every variable until she was paralyzed, but by identifying the one thing she was certain of and building from there. The one thing she was certain of. Decker wasn't at that meeting because of her nursing license. He was there because of the general. And if the general was now 3 steps ahead of whatever Decker was managing, then the question wasn't whether Olivia was in danger of losing her job. The question was what they were trying to keep buried and how far they'd go to keep it there. She put the car in reverse and pulled out of the lot. She drove for 20 minutes without a destination, out past the commercial strip on Route 9 and into the older residential grid of Ashport, where the houses had porches and the trees had grown tall enough to make tunnels of the streets. She was thinking about the name of the hospital Rourke had given her. She was thinking about 6 months ago. She was thinking about the phrase slowly developing, possibly untreated, which a cardiologist had used that morning in a clinical context, and which, in a non-clinical context, meant something that should have been caught and wasn't. She pulled into a gas station, parked at the edge of the lot, and called Rourke. He picked up in 2 rings. "Kellner put me on administrative leave," she said. A short silence. "When?" 20 minutes ago. They also tried to get me to sign a confidentiality document that would have limited my testimony in any future legal proceeding." "Did you?" "No." "Good." He exhaled. "Okay, the general said to tell you he's calling his attorney in the next hour. He also said, and these are his words, that Wayne Decker works for a healthcare consulting group called Veritas Partners, and Veritas Partners holds a management contract with the same facility where the general was treated 6 months ago." She stared through the windshield at a man filling his tank across the lot, not seeing him. "Veritas Partners," she said. "What do they do?" "What most healthcare consultants do. They advise on operations, financial structure, risk management. They also," Rourke said, "apparently advise on how to handle documentation when the documentation is a problem." She thought about the incomplete discharge notes, the gap in the record from 6 months ago. A managing injury, the cardiologist had said, a pattern consistent with something developing slowly. Whitaker was a retired general with public profile and presumably excellent medical coverage. His record should have been thorough. The fact that they weren't was a decision, not an oversight. "Who else knows about the previous hospitalization?" she asked. "The general, his personal physician, and now us. His attorney is being brought in. Beyond that..." Rourke paused. "There's one other thing. I've been talking to one of the ICU nurses, a woman named Tanya. She told me that last night, after the general was admitted, she received a call from someone in administration asking her to flag any staff members who spent extended time near the general's room, to log names and times. The gas station, the man with the gas nozzle, the ordinary machinery of a regular morning. They're watching who gets close to him," Olivia said. "They're watching who he talks to," Rourke said. "There's a difference." She understood the difference. He'd already talked to her, which meant they'd be moving faster now. "Can the general make a statement?" she asked. "Voluntarily to someone outside the hospital's authority, press, legal, it doesn't matter." "Can he do that physically?" "His pulmonologist cleared him for limited activity this morning. He's not fragile, just monitored." "Then the window is now," she said. "Before Veritas gets organized. Before Kellner and Hale finish whatever they're building. The general knows that too," Rourke said. "That's why he called you." Because she went home and opened her laptop and spent an hour being methodical. Veritas Partners wasn't difficult to find. They had a professional website with the sanitized language of an organization that wanted to appear helpful and transparent precisely because it wasn't. Healthcare operational consulting, revenue optimization, risk and compliance advisory, a client list that named categories rather than institutions, a staff page with headshots and titles. Wayne Decker was not on the staff page, but she found his name in a 3-year-old press release about a compliance review at a regional hospital system in Tennessee, listed as a senior advisory consultant. She cross-referenced the Tennessee hospital system and found a civil settlement from 2 years ago, a whistleblower case, a nurse practitioner who'd reported documentation irregularities and been terminated, and a settlement amount that was substantial and sealed but whose existence was public record. The nurse practitioner had been placed on administrative leave 6 days before the complaint was filed. Olivia sat back. The shape of it was clear now. Not every detail. She didn't have every detail and she knew it, but the architecture. Veritas Partners had a pattern: find the institutional exposure, contain the documentation, neutralize the people who could speak to it. The Tennessee nurse had been early enough to make it into a settlement. Whoever had been in that position in other cases might not have been so visible. She thought about Hale's face when she declined to sign the document. He'd expected her to comply. He'd expected the same thing everyone expected from a new hire on her second week: deference, uncertainty, the reflex of someone who still needed the job badly enough to sign whatever was put in front of her. She was on administrative leave. She didn't need the job badly enough for that. She drafted an email to a personal attorney she'd used for a lease dispute 2 years earlier in Mobile, brief and factual, attaching her forwarded copy of the meeting notification. She wasn't sure what she had yet, legally, but she wanted a record that someone outside the hospital knew what had happened this morning and when. Her phone rang at 20 past 11. It was a number she recognized, Riverbend Regional, main line. She answered. "Miss Hayes." "Kellner." Her voice was composed, which told Olivia she was working to make it so. "I wanted to follow up on this morning's meeting." "I've spoken with an attorney," Olivia said, which was technically true. A pause. "Of course. I also wanted to let you know that, given the sensitivity of the situation and the general's public profile, we've had some communication from the hospital's board this afternoon. The board has requested a full review of the Whitaker admission, including the clinical decisions made during the initial response." "That seems appropriate," Olivia said. "I'll cooperate fully with any review." "Yes." Kellner paused again, and this pause had weight in it, something she was deciding how to deliver. "I also wanted to inform you that a member of the General's party, Sergeant Rourke, came to the administrative office this morning with a formal inquiry about the hospital's confidentiality document. He was accompanied by an individual who presented credentials as a military legal officer." Olivia said nothing. "We explained that the document was a standard. Was the military legal officer able to review it?" A longer pause. "We provided a copy, yes." She thought about Rourke moving through the administrative wing with a JAG attorney at his side and felt something loosen, slightly, in her chest. Not relief, but the shift that comes when the weight you've been carrying alone is picked up by more than one pair of hands. "Thank you for letting me know," she said, and ended the call. At 2 in the afternoon, she got a text from an Ashport number she didn't have in her contacts. "Room 412. Come through the east stairwell. Rourke." She changed out of the clothes she'd been wearing all morning and put on jeans and a plain jacket, which was irrational. She was a nurse on administrative leave, not an operative, but the habit of looking unremarkable in uncertain environments was older than rational choice. She drove back to the hospital, entered through the east entrance near the administrative parking, took the stairwell to 4, and walked to 412 without stopping. Rourke opened the door before she knocked. The room was a private ICU room, slightly larger than standard, and Marcus Whitaker was sitting up in the bed with the head elevated to about 60 degrees, monitoring leads on, oxygen cannula under his nose, and the alert posture of a man who had been in worse situations than this one and knew it. Vega was on the floor to his right, and when Olivia came through the door, the dog raised her head and her tail moved once, low and deliberate, which was the dog equivalent of acknowledgement without performance. Whitaker was older than she'd expected, even knowing his age. Late 60s, heavy-set in the way of former military men who've kept the structure but let the padding accumulate. Silver-haired and pale from the admission, but with eyes that were alert and unimpressed by anything in the room. "Close it," he said to Rourke. The door closed. Rourke positioned himself beside it, which was the posture of someone securing the perimeter, which Olivia noted and understood. "Sit down," Whitaker said. She sat in the chair beside the bed. "You're the one who called the chest injury," he said. It wasn't a question. "Dr. Marsh confirmed and treated it. After you told him to listen again." His eyes were on her. "Rourke told me. The nursing staff told me. The attending physician's own note says he was alerted to the clinical concern by floor nursing staff, which is the most careful language I've read in a medical chart in some time." He paused. "Where did you serve?" She considered for a moment. "Several theaters, Ranger support, then JSOC attachment. MOS. 18 Delta." Something shifted in his face. "Special Forces Medical Sergeant. a designation that implied a level of training far beyond standard combat medic, a qualification that most civilian nurses and most civilian hospitals didn't carry and couldn't approximate. How long? 8 years total, 2 different units. He was quiet for a moment, then, I deployed twice as a general officer. I've worked with 18 Deltas. The ones I worked with could run a forward surgical element with one hand. He looked at her. And you've been working as a floor nurse. I needed to be somewhere quiet. He accepted that without comment, which she appreciated. I need to tell you something, he said, and I need you to understand that what I'm about to tell you is the reason Decker is in this hospital and the reason they put you on leave. She waited. 6 months ago, I was treated at a facility called Hargrove Medical Center, private hospital about 40 miles from here. I went in with what I thought was a respiratory infection. He shifted against the pillows, carefully. I was discharged 3 days later with a diagnosis of acute bronchitis and told to follow up with my primary. I was not told about any structural abnormality in my chest imaging. I was not told that my right lung was showing early signs of compression. I was given antibiotics and sent home. Olivia looked at him. My personal physician reviewed the Hargrove imaging 2 months later. She requested the records as part of a routine check, and she noted the abnormality. She referred me to a pulmonologist. The pulmonologist expressed concern, but the images from Hargrove had been amended. The language in the revised discharge summary did not match the original imaging report in her possession. Amended, Olivia said. Somebody went back into the records and changed what the imaging showed, or changed how it was characterized. My physician has the original in her files. The version in the Hargrove system is different. She sat with that for a moment. A retired general with a documented record of a missed and altered diagnosis. A Veritas Partners consultant appearing at the hospital where that general had just nearly died of the untreated injury. Administration moving to limit testimony. The document she'd refused to sign. They're afraid of what the record shows, she said. They're afraid of what the record shows, and they're afraid of what I'll do with it. He looked at her. And right now they're also afraid of you because you're the person who caught what Hargrove let get to this point. And if you testify to what you observed clinically on the day I came in, it creates a timeline that makes the Hargrove failure impossible to dismiss as coincidence. She understood now, fully, why they'd moved so fast. The confidentiality document, the administrative leave. They hadn't been protecting the hospital from liability over her scope of practice. They'd been trying to seal her off before she could become a witness. My attorney arrives tomorrow morning, Whitaker said. He's bringing a medical records expert and a former DOJ investigator who now works in healthcare fraud. Rourke has already provided a statement. My personal physician is available to provide her documentation of the original imaging report. And me, Olivia asked, I'd like you to provide a clinical account of what you observed when I arrived. Your qualifications, your assessment, the intervention. On the record. He paused. I'm not asking you to do this for me. I'm asking because the people who altered those records have done this before and they'll do it again. And the reason they keep doing it is that the people who know enough to stop them sign the document and go home. She thought about the Tennessee case, the nurse practitioner, the sealed settlement. She thought about Rourke calling her at 6:47 in the morning because he'd recognized a pattern he'd seen happen to people he cared about. She thought about Vega sitting down on a hospital floor when she said 2 words, not because the dog had been told to trust her, but because the dog had simply known. I'll provide the statement, she said. Whitaker nodded once. Good. She stood. Rourke moved to open the door and she was already stepping toward it when Whitaker spoke again. Hayes. She turned. His voice had a different quality now, rougher. The performance of authority stripped back for just a moment. Whatever they told you in that room this morning about transparency, institutional trust, scope of practice, he stopped. They do this to people. They find the right language to make you feel like the problem. Don't take it in. She looked at him for a moment. I don't, she said. Not anymore. She walked out. The east stairwell, 4 flights, the parking lot, her car. She sat in the driver's seat and looked at the hospital's brick facade in the afternoon light. And she thought about what Whitaker had just told her, and she thought about the document she hadn't signed. And she thought about the original imaging report sitting in a physician's files that contradicted the version in the Hargrove system. And then her phone buzzed. A text from Priya. All caps, no punctuation, sent at 2:49 p.m. They pulled your personnel file and sent it to the board. Olivia, there's something wrong with it. Something is different from what you submitted. I saw it on Hale's desk. They changed something. She read the text 3 times. Not because she didn't understand it, she understood it on the first pass, but because she needed to be precise about what it said and what it didn't say. And there was a version of this where Priya was alarmed about something that turned out to be a filing error. And there was another version where it was exactly what it sounded like, and she needed to know which version she was in before she moved. She called Priya. Priya answered on the first ring, which meant she'd been holding the phone. What did you see? Olivia kept her voice low, measured. I was passing Hale's office. The door was open. I wasn't trying to look. It was just there on his desk, and the top page had your name on it, and I could see it was a personnel form, and the dates. Priya stopped, steadied herself. The employment history. The dates were different. The gap you had listed between your previous work and this job, it was filled in with something. I couldn't read what, but it wasn't blank the way yours was. How do you know what mine looked like? Because I was on the hiring committee last quarter. I reviewed 11 files. Yours was one of them. I remember the gap because Donna mentioned it, and I had to note it as discussed. Olivia sat very still. You were on the hiring committee. For 2 months. I rotated off in December. A pause. Olivia, they put something in your file that wasn't there before. She thought about the document she hadn't signed, the way Foss's pen had stopped moving when she'd declined, the look that had passed between Hale and Kellner. They hadn't expected her to push back. When she had, they'd moved to a different option. Priya, she said, I need you to write down exactly what you saw. Exactly. Date, time, what you were doing, what was on the desk, what you could read. Don't send it anywhere. Don't tell anyone else. Just write it down and keep it. Okay. Priya's voice was smaller now, aware of the gravity of what she'd stumbled into. Are you okay? Yeah. She wasn't entirely sure that was true, but it was close enough. Don't worry about me. Write it down. She ended the call and immediately texted Rourke. They've altered my personnel file. I need the JAG officer's contact before morning. The reply came in 90 seconds. Already on it. Attorney meeting moved to 7 a.m. You're included. She sat in the car for another minute. Around her, the hospital parking lot did what it always did. The ordinary traffic of shift changes and visitor arrivals and delivery vehicles, the unremarkable infrastructure of a day continuing without any acknowledgement of what was unraveling inside the building's administrative wing. She took a photo of Priya's text, sent it to her personal attorney with a brief message. New development. They've modified my employment file. Please advise on preserving documentation. Then she drove home, and she made coffee she didn't drink, and she sat at her kitchen table with a notepad and wrote down everything she could recall about the personnel form she'd submitted at application, every field, every date, every piece of information she'd provided. Because the most useful thing she could do right now was create a contemporaneous record of the original document in her own hand, time-stamped tonight, before the morning. She wrote for 40 minutes. Her handwriting, normally careful, was slightly angular at the edges, which was the only outward sign of what she was carrying. She slept 4 hours. It was enough. The attorney's name was Garrett Solis, and he had the compact, unhurried manner of someone who had been in enough difficult rooms to stop being impressed by difficulty. He arrived at 7 with a leather briefcase that looked like it had been through more than a few proceedings, sat across from Whitaker's bed in the private ICU room, and within the first 10 minutes of the meeting had established 3 things: that the original Hargrove imaging report in Whitaker's physician's possession constituted a prima facie documentation discrepancy, that the confidentiality document presented to Olivia was legally aggressive in a way that would not survive scrutiny, and that the alteration of a nursing candidate's employment file was potentially criminal, depending on what had been added and who had authorized it. The JAG officer, a captain named Torres, compact and efficient, who spoke in the clipped cadence of someone accustomed to making legal arguments under time constraints, confirmed that Whitaker's case had sufficient grounds to request a formal DOD Inspector General inquiry into the Hargrove documentation, given the general's status and the potential implications of a deliberately missed diagnosis on a retired senior officer. Olivia sat across from Solis and laid out what she had: the timeline of the admission, her clinical assessment, the meeting with Hale and Kellner, the unsigned document, Priya's observation, and the pattern she'd found on the Veritas Partners press history. Solis listened without interrupting. When she finished, he said, "You documented all of this as it happened?" Email forwarding, photos, written contemporaneous notes dated last night. Good. He said it flatly, as if it were the minimum reasonable standard, which, from his perspective, it probably was. The file alteration is our most immediate problem. If they've added material to your employment record, that's potentially fraud. It's also evidence of consciousness of guilt, which means someone in that administrative chain knew they were doing something that required covering. Hale, Rourke said. Possibly. Possibly Decker through Hale. We'll need to establish who had access and who authorized the change. He looked at Olivia. Do you have any copy of the original file you submitted? Application portal confirmation? Any saved drafts? I submitted through the hospital's online portal. I have the confirmation email with a timestamp. The form itself? I filled it out in the portal directly. No saved copy on my end. She paused. But Priya Sood was on the hiring committee that reviewed it. She can attest to the original contents. A witness who saw the original file before alteration. Solis made a note. We'll need her formal statement. Is she willing? I'll ask her today. Ask carefully. If administration realizes she saw the desk, she becomes a target. Olivia understood that. She'd been thinking about it since last night. Whitaker, who had been listening from the bed with the patience of a man who knows how to wait without going somewhere else in his head, said, What's the timeline? The board meets on Thursday, Solis said. That's 4 days. If Hale and Kellner are moving on the personnel file, they're trying to have a completed record, one that justifies the administrative leave as a response to discovered irregularities in her application, before the board convenes. That reverses the sequence of events. In their version, the leave happened because they found something wrong. In reality, the leave happened because I caught something they didn't want on record, Olivia said. Exactly. Solis capped his pen. We need to move before Thursday. That means the physician's original imaging records need to be formally submitted to the IG today. It means a formal complaint about the personnel file alteration goes to Georgia's nursing board and to the hospital's external accreditation body today. And it means we request an emergency board session, not Thursday's regular meeting, but an emergency convening, on the grounds that there is active institutional misconduct occurring within the administrative chain. Can you do that? Rourke asked. The general can do that, Solis said, looking at Whitaker. As the patient at the center of the clinical event, he has standing to request a board review of any decisions made regarding his care, including decisions made regarding the staff who provided that care. Whitaker said, Do it. What happened next took 36 hours and was not clean or elegant or sequential in the way that stories sometimes make things seem. It was messy, and it ran on phone calls and counter calls, and people misunderstanding their own legal exposure and reacting in ways that made everything worse for them. Solis filed the accreditation complaint at 9 in the morning. The nursing board inquiry was submitted electronically by 10. The IG referral, transmitted through Captain Torres, went out at 11 with Whitaker's name on it, which was, as Solis had predicted, the piece that moved things fastest, because a retired general's name on a DOD referral triggered a response time that the institutional bureaucracy reserved for situations involving public consequence. By noon, the board chair, a woman named Diane Ashford, who Olivia had never met, who ran a regional bank and sat on 3 nonprofit boards and had been on Riverbend's governance committee for 11 years, had received a call from Solis, a call from the accreditation body's compliance office, and a message from the hospital's external legal counsel advising her that the situation had acquired dimensions that required her immediate attention. Olivia knew none of this in real time. She spent the morning at home, gave Priya's contact information to Solis with Priya's permission, and wrote out her formal clinical statement in the careful language of someone who knows the document will be read by people looking for inaccuracy. She described the admission. She described her assessment. She described the commands given to Vega, the clinical observation, the exchange with Marsh. She used precise medical terminology for everything that was clinical and plain language for everything that was procedural. She was on her third pass editing it when Marsh called. She almost didn't answer. Then she did. "I've been contacted by the board chair's office," he said without preamble. His voice had the tight quality of someone managing strong feeling. "They're conducting an emergency review. I've been asked to provide a clinical account of the Whitaker admission." "That seems appropriate," she said. "I also received a call from Hale this morning, before the board chair's office called." He paused. "He suggested I characterize the clinical events in a particular way. He suggested that the pneumothorax call was ambiguous, that you had been in the bay without authorization, and that your assessment had introduced confusion rather than clarity." She said nothing. "I told him the documentation speaks for itself," Marsh said. "My own note reflects the sequence of events accurately. I wrote it the night of the admission while it was fresh. I'm not revising it." She was quiet for a moment. "Why are you telling me this?" "Because Hale is going to find out I didn't do what he asked, and I'd rather you knew that I didn't." He stopped. "You caught something I was moving past. I'm not going to rewrite that because it's inconvenient for someone's liability exposure." She thought about the first week. The septic patient. Donna's correction in the corridor. Marsh's measured patience that had felt like scoring points. He was imperfect. He was also telling her something true and doing it voluntarily. "Thank you," she said. "Don't thank me. Just make sure your statement is airtight." He paused again. "Is it?" "Yes." "Good." He hung up. She went back to editing. The emergency board session was called for Wednesday morning, 48 hours after Solis's filings. Diane Ashford had apparently moved with a speed that surprised everyone, including, according to Rourke, who had sources in the hospital Olivia didn't ask about, Hale himself. Olivia arrived at the hospital at 8:30 in a jacket she'd brought from the back of her closet, dark navy, the kind of thing she put on when she needed to look like she'd made a decision about being there. Solis was waiting in the lobby with Torres, and they walked together to the fourth-floor conference suite, which was a different room from the second-floor board presentation room. Larger, with a long table and 12 seats, and the faint smell of formal proceedings. Whitaker arrived in a wheelchair pushed by Rourke, which he objected to out loud and then accepted with the resigned compliance of a man who'd been told by 3 medical professionals that he was not yet cleared to walk extended distances and had decided the argument wasn't worth the energy. Vega walked beside the chair, leashed but alert, and every person in the corridor who saw them step out of the elevator stopped what they were doing. The board assembled, 8 members, Ashford at the head, the rest a mix of community leaders, medical professionals, and institutional representatives that Olivia had never encountered, but whose names she'd looked up the previous night. They did not look comfortable. Several of them had the expression of people who had been called into a situation they'd received inadequate briefing on and were now reconstructing the shape of in real time. Hale was there. Foss was there. Kellner was there, in a different configuration from the previous meetings. Not running the room, not presenting, just present. Decker was also there, which surprised Olivia, and then, on reflection, didn't. If you're managing institutional exposure, you want to be in the room where decisions are made. The legal man from the confidentiality document meeting was not there, which was interesting. Ashford opened the session without ceremony. "This is an emergency governance review convened under Article 7 of the hospital's charter. It's not a disciplinary hearing. It's a fact-finding session. Everyone here will have the opportunity to speak. We'll start with the clinical record." She had the record in front of her. All of it. The admission notes, Marsh's documentation, the ICU transfer summary, and, Olivia noted, something printed on different paper that was positioned separately from the hospital file. She suspected that was the Hargrove imaging discrepancy, though she couldn't read it from across the table. Marsh was called first. He gave his account, factual, sequential, unambiguous, about the sequence of the pneumothorax assessment. When Ashford asked him directly whether Olivia's intervention had been within clinical scope, he said, "A nurse flagged a clinical concern to the attending physician. That's exactly how it should work. I confirmed the concern and treated it. The patient is alive. Ashford wrote something down. Kellner was asked to explain the administrative leave decision. She did, in the careful language of institutional risk management, and it sounded reasonable in isolation. Scope of practice review. Undisclosed background. Appropriate caution pending review. Then Ashford asked, "Was Ms. Hayes's personnel file reviewed as part of this decision?" Kellner said yes. "When was the file reviewed?" "Prior to the leave decision." And when was it last modified by administrative staff?" A beat. Kellner's composure held, but something behind it shifted. "I'd need to check the system log." "We've already checked the system log," Ashford said. "The file was modified at 11:42 p.m. on the night following Ms. Hayes's administrative leave meeting. Can you explain what was changed and who authorized the change?" The room was quiet in a specific way. The way rooms go quiet when a question exposes the gap between what someone planned to say and what they now have to say. Kellner looked at Hale. Hale was looking at the table. "I'm not aware of any modification," Kellner said. "The system log shows access by a user with administrative credentials registered to this hospital's risk management suite," Ashford said. "The modification added a notation to Ms. Hayes's employment history that was not present in the original submission. The original form, time-stamped at application, does not contain this notation." She set down one sheet, picked up another. "Ms. Foss, your credentials are associated with the risk management login." Foss's pen was still. Her legal pad was closed. "I'd like to consult with counsel before, she began. "That's your right," Ashford said calmly. "But the board needs to understand, for the record, whether the modification to Ms. Hayes's file was made on the authorization of hospital leadership or independently." The room held. Decker spoke. It was the first time he'd spoken in the session, and the timing was a mistake. Olivia could see that, and she suspected Solis, who was sitting 2 chairs from her, saw it too. Decker said, "I'd like to offer some context about the broader institutional picture." "Mr. Decker," Ashford said, "you're listed on our visitor log as a consultant retained by Veritas Partners. Veritas Partners holds a management contract with Hargrove Medical Center. You are not a board member, not a staff member, and not a party to this proceeding. You're present as a courtesy. I'd ask you to observe." She didn't raise her voice. She didn't need to. Decker closed his mouth. Olivia looked at the table and did not allow herself any expression. Opa. Whitaker spoke for 11 minutes. He spoke from the wheelchair, which he had positioned at the table's edge, and he spoke without notes, which was either confidence or theater, or both. He described the Hargrove admission. He described the incomplete treatment. He described his personal physician's discovery of the original imaging report and the discrepancy with the amended version. He described his arrival at Riverbend, his memory fragmentary up to a point and then clarifying, the oxygen and the monitoring leads, and the particular moment when he'd become alert enough to understand that he was still alive, and that something that should have killed him hadn't. "I've been in situations where the difference between alive and dead was one person making one correct call under pressure," he said. "I know what that looks like. What Ms. Hayes did in that bay, the assessment she made, the way she communicated it, that's not a nursing school skill. That's battlefield-trained pattern recognition applied to a clinical setting. It saved my life." He paused, and in the pause was the weight of a man who didn't use that phrase casually. The response from this hospital's leadership was to put her on leave, alter her personnel file, and present her with a document designed to limit her legal testimony. Ashford said, "General, are you prepared to submit a formal statement to this effect?" "I've already submitted it," Whitaker said, "to your board, to the Georgia Nursing Board, and to the Department of Defense Inspector General's office." Decker looked at the ceiling. Hale pressed his hands flat on the table, and for a moment Olivia thought he was going to speak, and then he didn't. The session continued for another hour and a half. It was not the theatrical unraveling of a courtroom drama. It was slower and more grinding than that, the institutional mechanism doing what it does when someone has finally given it enough information to move. Questions and documentation and requests for records, and the particular discomfort of watching people who have operated behind the language of process discover that process, when correctly applied, does not protect them. Foss submitted a statement through the hospital's own legal counsel that she had been instructed to make the file modification by Hale and that she had understood it to be within the scope of an administrative review. The statement implicated her and partially transferred the weight upward. It was the decision of someone who had assessed their exposure and chosen the smaller version of the consequence. Hale had no such pivot available. His name was on the instruction. His credentials were tied to the decision to bring Decker in. His signature was on the administrative leave documentation that had cited scope of practice irregularities, which Marsh's clear and unambiguous clinical note now made impossible to sustain. Kellner, who had, Olivia came to understand during the session, been less architect and more complicit bystander, had the particular expression of someone watching the vehicle she'd agreed to ride in drive off a cliff. She cooperated with the board's documentation request completely and without resistance, which was either pragmatic self-preservation or the response of someone who had genuinely not understood the depth of what Hale and Decker had been doing until this morning. Olivia, when it was her turn, gave her clinical account. She answered every question directly and completely. She did not editorialize. She did not perform. When Ashford asked her whether she felt she had been treated fairly by the hospital's administration, she said, "No," without elaboration, which was the truest and most efficient answer available. When Ashford asked her what outcome she was seeking, she said, "Reinstatement, correction of my personnel file, and an explanation of how a management consultant with ties to a facility that failed this patient ended up in an internal administrative meeting about the nurse who caught that failure." The room was quiet. "That," said Ashford, "is a question this board intends to answer." The session ended at 11:45. Solis walked with her to the elevator, and in the elevator he said, "That went as well as it could have," which from him was close to effusive. "What happens to Hale?" she asked. "The file modification puts him in a different category from the rest of it. The leave decision, the confidentiality document, those are institutional overreach, potentially actionable, but defensible as policy judgment in bad faith. The file modification is falsification of an employment record. That's a different statute." "And Decker?" "Veritas Partners is going to have a conversation with the IG about the Hargrove documentation. Whether Decker personally is implicated depends on what that investigation surfaces. But his relationship with Hargrove and his presence in this hospital during an active suppression effort..." Solis paused. "He knows what his exposure is. He's been calculating it since Ashford cut him off." She thought about Decker at the ceiling, the brief unguarded moment of a man doing arithmetic. "What do I do now?" she asked. "You go home," Solis said. "The board needs time to formalize its findings, probably 24 to 48 hours. I'll call you when there's a decision." He looked at her. "You did well in there." "I told the truth. That's what doing well looks like in that room." The elevator opened. She walked through the lobby, past the main desk, past the ER doors that had slammed apart 4 days ago with 3 Marines and a retired general and a combat dog and the beginning of everything that had followed. She was halfway through the automatic doors when she heard her name. She turned. Priya was at the nursing station, leaning over the counter, and her face had a look that Olivia had learned to read over the past 2 weeks. The look of someone who has information and is deciding whether it's the right moment for it, and has decided it is. "The board chair's assistant called the nursing floor 20 minutes ago," Priya said. She kept her voice low, though the lobby wasn't crowded. "She was asking for Donna." "For Donna?" She wanted to know how long Donna had been with the hospital, and whether Donna had ever been on any hiring committee. Priya paused. "And then she asked whether Donna had been present at any meetings about your leave decision." Olivia looked at her. "Donna was in Hale's office yesterday morning," Priya said. "Before the board session. I saw her go in. She was there for almost an hour." She hadn't known that. She hadn't thought about Donna, not in this configuration, not as a participant rather than a bystander. Donna, who had handed her the orientation packet on day 1. Donna, who had corrected her in the corridor about overstepping. Donna, who had been on the hiring committee and had noted the gap in her employment history, specifically noted it in a way that had found its way into the conversation about her file. Donna, who had access to the hiring documentation. Donna, who knew exactly what the original form looked like. She stood at the edge of the automatic door threshold, half in and half out of the building, the Ashport morning on one side and the lobby on the other. The question wasn't whether Donna had been involved. The question was whether Donna had been a principal or an instrument, and the answer to that question was going to determine whether the thing she thought was collapsing had actually finished collapsing yet. Her phone buzzed. Solus. She answered. "There's a problem, Watts," he said. The system log the board used to identify the file modification, Foss's credentials, 11:42 p.m. Our technical consultant just finished reviewing the full access record. He stopped, and in the stop was the particular quality of a careful man flagging something that changes the shape of a situation. Foss's credentials were used, but the IP address of the access doesn't match any device registered to the hospital's network. Someone used her login remotely, from outside the building. She absorbed that. Which means, she said, Foss may not have made the modification herself. Foss may not have known about it at all. Her statement said she was instructed by Hale, but if someone else used her credentials remotely, then Foss's statement implicates Hale for an instruction he may not have given, because whoever used Foss's credentials didn't need an instruction. They just needed the login. And the only people who would have Foss's credentials, Solus said, are people with access to the hospital's administrative system from outside the building. She was standing very still in the doorway. Veritas Partners was a healthcare consulting firm. They provided operational advisory services. They had system access to client hospitals as part of their management contracts. She said, "Does Riverbend have a consulting contract with Veritas?" A pause. "I don't know. I'll find out." "Find out fast," she said. "Because if they do, Decker didn't need anyone inside this hospital to change my file. He could have done it himself." Solus called back in 19 minutes. Riverbend Regional Hospital had a technology services agreement with a subsidiary of Veritas Partners. The agreement, signed 14 months earlier, covered electronic health records optimization, administrative workflow consulting, and, this was the part Solus read slowly, making sure she heard it, system integration support, which included administrative credential management, which meant Veritas Partners had, as part of a legitimate contractual relationship, back-end access to the hospital's administrative systems. Staff login credentials. Document management. Personnel files. Decker had not needed Foss. He had not needed Hale's explicit instruction. He had walked into Riverbend as a consultant with a briefcase and a quiet suit, and he had brought with him something more useful than leverage. He had brought access. The kind that doesn't require anyone to do anything suspicious because it's already written into the contract. She was still standing in the doorway. "How long has this been the model?" she asked. "I don't know yet," Solus said. "But if Veritas has management contracts at multiple facilities and technology services agreements at the same facilities, then they have a mechanism. They don't just advise on documentation, they can manage it directly." She thought about the Tennessee whistleblower case, the sealed settlement. She thought about whether that nurse practitioner had ever known exactly how her file had been compromised, or whether she'd gone home with a settlement check and an explanation that didn't quite add up, and no way to prove the rest of it. "This goes to the IG today," she said. "It goes to the IG today," Solus agreed, "and to the State Attorney General's office, because the Technology Services Agreement is a state-registered contract, and the misuse of administrative access under that contract is a different category of violation from the Hargrove medical records issue. This is fraud, potentially, across multiple institutions." She stepped fully outside. The door closed behind her. The Georgia morning was clear and hot and smelled like cut grass and distant rain. "Tell the general," she said. "He's my next call." Solus paused. "Hayes, this is bigger than your file." "I know. I want to make sure you understand that the next phase of this is going to be out of your hands. The institutions will take it from here. The IG, the AG's office, the accreditation body. Your role becomes witness, not protagonist." She almost smiled at that. "I was never trying to be the protagonist." "No," he said. "You weren't." He hung up. She stood in the parking lot and she thought about Donna. She found Donna in the break room at the end of the nursing wing, which was where Donna went between patients when she needed a moment. which Olivia had learned from 2 weeks of observation. Donna was standing at the coffee machine with a paper cup and the expression of someone who had not slept well and had not yet decided what to do about that. She looked up when Olivia came in. Her face did something complicated. "You're not supposed to be here," Donna said. "You're on leave." "I'm not here in a clinical capacity," Olivia said. She kept the distance of a few feet between them. "I need to ask you something directly, and I need you to answer directly." Donna set the cup down. "Were you in Hale's office yesterday morning?" A beat. Donna's jaw tightened. "Yes." "Were you there about my file?" Another beat, longer. "He told me it was a documentation review, that the hiring committee's notes needed to be reconciled with the current file. He wanted to know what I remembered about the original application." "Did he tell you why?" "He said there was an inconsistency." Donna looked at her. "I told him what I remembered. I told him the employment history had a gap and that the committee had noted it." She stopped. "He was writing things down. He thanked me and I left." Olivia looked at her. Donna was not a dishonest person. She was a woman who operated within institutional structure and trusted that the structure was operating in good faith, which was a form of faith that the structure did not always deserve. "He was building a record," Olivia said. "A retroactive justification for the leave decision. Using your testimony about the original file to support a version of events where my background was always the problem and the leave was always warranted." Donna absorbed that. Something shifted behind her eyes. Not guilt, but the particular recalibration of someone who has just understood that they were used. "I didn't know that," Donna said. "I know you didn't." "I should have," she stopped. "I should have asked more questions." "Yes," Olivia said. "You should have." She said it without cruelty. It was just true. Donna looked at the coffee cup. "What happens now?" "The board's investigation will probably include a conversation with you. Tell them exactly what you told me, what he asked, what you said, what you observed." She paused. "If you're honest, you're a witness. If you're not, you're something else." It was a harder thing to say than it sounded. Donna had corrected her in corridors and assigned her tasks with the casual authority of someone who had never considered that the person receiving the assignment might have forgotten more about emergency medicine than most people in the building would ever learn. She had been, in the small daily way, part of the ambient dismissal, but she hadn't fabricated anything, and she hadn't known what it was being used for, and those distinctions mattered. "I'll be honest," Donna said. "Good." Olivia turned to go. "Hayes?" She stopped. Donna said, "The sepsis patient, week 1. You called that before the triage screen did." She paused. "I knew you were good. I didn't know what I was looking at." Olivia considered that for a moment. It wasn't an apology. It was something more honest than an apology. An acknowledgement without the performance of remorse. A simple statement of fact from a woman who dealt in simple statements of fact. "Now you do," Olivia said, and left. The board's formal findings were released 31 hours later. Solis called her at 6:40 in the morning, which was becoming the hour at which news arrived, and read her the summary in the careful language of institutional governance that, once translated, said the following. Gordon Hale had been placed on immediate administrative suspension pending a formal investigation into the unauthorized modification of an employee's personnel file and the improper use of institutional resources to limit the testimony of a clinical witness. He was not in the building when the findings were released, which someone on the nursing floor would later describe as suspicious, and which Rourke, when Olivia told him, described as the behavior of a man who had read his own exposure correctly. Renata Foss had been placed on administrative leave pending the investigation's determination of her level of participation versus the unauthorized use of her credentials. The distinction mattered legally. It was still being resolved. Patricia Kellner retained her position as CMO on the condition that she cooperate fully with both the internal investigation and the State Attorney General's inquiry into the Veritas Partners Technology Services Agreement. She had already retained independent counsel, which Solis described as the correct and predictable decision of a woman who understood which direction the wind was blowing. Wayne Decker and Veritas Partners were formally referred to the Georgia Attorney General's office for investigation into the misuse of administrative system access under a state-registered services contract. Veritas Partners' technology services agreement with Riverbend Regional was suspended immediately. Their management contract with Hargrove Medical Center was referred to a separate regulatory body for review. Hargrove Medical Center's failure to properly document and treat General Whitaker's chest abnormality was referred to the State Medical Board and to the DoD Inspector General, with the original imaging report provided by Whitaker's personal physician as the evidentiary anchor. Olivia Hayes' administrative leave was rescinded, effective immediately. Her personnel file was restored to its original submitted form. A formal note was added to the record documenting the unauthorized modification and its correction. She listened to all of it without speaking. When Solis finished, she said, "Is that everything?" "That's the board's formal action. The external investigations will take longer. The AG's office could be 6 months to a year. The IG process for the Hargrove matter will depend on how many facilities they find the same pattern at." He paused. "But for you, personally, yes, that's everything." She sat with it. It didn't feel the way she'd expected. Not triumph. She hadn't been expecting triumph, which was probably good because triumph was a thin and temporary feeling, and she had learned that a long time ago. It felt more like the moment after a long carry, when you've been moving under weight for long enough that putting it down doesn't immediately feel like relief because your body hasn't registered yet that the weight is gone. "Thank you," she said. "You did the harder part," Solus said. "I just organized what you built." She went back to work on a Thursday. The floor was the same floor. The supply carts were in the same positions. The whiteboard at the nursing station had the same handwriting patterns, different names. The ER smelled the same, antiseptic and old coffee, and the particular institutional air of a building that runs 24 hours and never fully airs out. Priya was at the desk when she came in, and when she saw Olivia, she stood up and then seemed to decide that standing up wasn't sufficient and came around the desk and hugged her, briefly and hard, in the slightly awkward way of someone who doesn't usually hug colleagues but has decided the moment requires it. Olivia accepted it without stiffening, which was its own small accomplishment. "Welcome back," Priya said. "Thanks for the text," Olivia said. "The one about the file." Priya shook her head. "I almost didn't send it. I kept thinking I was overreacting." "You weren't." "I know." She looked at Olivia for a moment. "I know that now." The morning ran. She had 4 patients on the floor, 2 post-surgical, 1 cardiac monitoring, 1 overnight observation from an ER admission, and she moved through them with the same economy of motion she'd always had, the same quiet attention to the details that most people's eyes slid past. She noted a medication timing that needed clarification and flagged it. She noticed that one of the post-surgical patients was guarding on one side in a way that didn't match the surgical site and asked the attending to reassess, which he did, and which turned out to be a minor positional issue that was corrected simply and without drama. Nobody told her she was overstepping. Marsh passed her in the corridor mid-morning, heading toward the ER. He looked at her, then gave a short nod that in hospital culture was the equivalent of a speech. She nodded back. At noon, she received a message from Rourke. "General's being discharged tomorrow. He wants to see you before he goes. Room 412, after your shift." She was there at 4:15. Whitaker was out of the monitoring leads now, the oxygen cannula gone, dressed in civilian clothes, dark pants, a collared shirt that had clearly been brought in by someone because it was pressed, and seated in the bedside chair rather than the bed, which was a man communicating something about his current status. Vega was beside him. The room had the slightly deflated quality of a space about to be vacated. Rourke was there, and a woman in her late 40s who Rourke introduced as the general's personal physician, Dr. Amara Boateng, who had driven up from Savannah that morning to handle the discharge herself. Boateng shook Olivia's hand with the directness of a doctor who has no interest in ceremony. "I've reviewed the admission notes," she said. "The pneumothorax presentation, the timeline, your communication to Dr. Marsh." She paused. "If you'd been 30 seconds slower, the transport to surgery would have killed him." Olivia said, "Marsh responded well." "Marsh responded after you flagged it. Don't deflect." She said it the way a colleague speaks to another colleague, without hierarchy. It was the first time since she'd walked into Riverbend that someone had spoken to her exactly that way. Whitaker looked at her from the chair. Vega's tail moved once. "Sit down," he said. She sat. "I want to ask you something," he said. "And I want you to answer honestly, not the way you think I want you to answer." "Okay. Why did you leave the military?" She'd known the question was coming. She'd known it since she'd understood who he was. She took a moment with it anyway, because the honest answer wasn't the simple one. "I was good at it," she said, "and I needed to find out if there was anything else I was." He looked at her. "Was there?" "I'm still working on that." He almost smiled. "Honest enough?" He leaned forward slightly in the chair. "Here's what I know about you based on the last 4 days. You walked into a situation that could have ended a man's life, and you made the correct call under pressure without anyone asking you to. You walked into a situation that was actively trying to compromise your career, and you didn't sign the document, didn't defer, didn't take the institutional exit they were offering. And you did both of those things without making them about yourself." She didn't say anything. "That's a particular set of characteristics," he said. "I've spent 40 years looking for it in people and not always finding it." He looked at his hands for a moment, then back up. "I'm going to be making some noise about the Hargrove situation, the IG process, the AG's investigation, Veritas. It's going to get visible. I have a platform and I intend to use it." "Good," she said. "When it gets visible, there will be people who want to know the full story of what happened in that ER. The clinical picture, the administrative response, the whole sequence." He paused. "I'm not asking you to be a spokesperson. I'm not asking you to do anything that's outside what you've already done. But I want you to know that when those conversations happen, I'll be naming you, not as a victim, as the person who got it right." She sat with that. "There's something else," he said. "Boateng." He looked at his physician, who had positioned herself near the window with the air of someone waiting for a cue. "Riverbend's board reached out to me yesterday," Boateng said. "They're looking to restructure their approach to veteran healthcare and trauma readiness. The events of the past week have accelerated that conversation. They're creating a new position, clinical lead for veteran care integration and trauma preparedness. It would involve developing protocol, overseeing training, and serving as the primary clinical liaison for any military-adjacent cases." She looked at Olivia without pretense. "It's a floor nurse position in title only. In function, it's considerably more than that." Olivia looked at her, then at Whitaker. "The board is offering this to me," she said. "The board is offering it because I told them what they had," Whitaker said, "and what they'd nearly thrown away." She sat with the weight of it. Not because she was uncertain, she knew almost immediately that she was going to accept, because the work was what she had always been built for. And this was a shape of the work she hadn't been able to see from the floor nurse position, but could see clearly now. She sat with it because she wanted to feel the full size of it before she moved, because she had learned in 8 years of combat medicine and 2 weeks of a civilian hospital and 5 days of a crisis that had redrawn the map, that you don't move past things worth feeling until you've actually felt them. "Yes," she said. Whitaker nodded once, the way he'd nodded when she'd agreed to give her statement. Compact. Satisfied. The nod of a man who has assessed a situation and found it resolved correctly. Boateng said, "I'll let the board know." Vega stood up from the floor and pressed her head briefly against Olivia's knee, which was the dog's own form of formal communication, and then went back to her position at Whitaker's side. Hale resigned 6 days later, before the internal investigation had formally concluded, which Solis told her was the behavior of someone who had received legal advice about what the investigation was going to find. His resignation letter cited personal reasons, which was the institutional language for a negotiated exit, which was itself a translation of a man understanding that the alternative to leaving quietly was not quiet. Foss's situation resolved differently. The investigation determined that her credentials had been accessed remotely without her direct knowledge on the night of the file modification. The IP address confirmed it. And while her meeting with Hale to discuss Olivia's original application remained a compliance concern, the modification itself was not attributed to her. She received a formal reprimand and mandatory ethics training and kept her position, which was perhaps more than she deserved and less than Hale received, and was the kind of imperfect outcome that the machinery of institutional accountability tends to produce. Decker and Veritas partners were a longer story. The AG's investigation opened formally within 2 weeks of the referral. It was not, as Solis had predicted, a fast process, but it moved, and it moved with the particular momentum of an investigation that has strong documentation and a visible plaintiff with a decorated service record and a willingness to be public about it. 3 other former hospital employees from 2 different facilities in the Veritas network contacted the AG's office within the first month of the investigation. One was a physician's assistant from a hospital in Alabama. One was a charge nurse from a facility in Tennessee, not the same nurse practitioner from the earlier settlement. A different case, a different documentation manipulation, the same architecture. The third was a records administrator who had noticed discrepancies in a patient file 2 years earlier, been told it was a system error, and kept her notes because something hadn't felt right. They had all known something was wrong. None of them had known what they were looking at until someone finally gave the pattern a name. Hargrove Medical Center's medical director resigned under pressure from the state medical board, which had found sufficient evidence of systemic documentation failure to warrant formal review of the facility's accreditation. Hargrove itself remained open. These things don't close overnight, if they close at all, but it was operating under external oversight, which was a different and more scrutinized existence than it had enjoyed before. Olivia knew all of this piecemeal, the way you know things that are happening at the edge of your field of vision while your attention is elsewhere. She was busy. The new position had a formal title. She had input on it, and the title they agreed on was Trauma and Veteran Care Integration Lead, which was accurate and unadorned, and she preferred it that way. And building its infrastructure from the ground up was not a small project. She developed the protocol framework in the first month. She worked with Boateng, consulting remotely, and with a military medicine specialist at Augusta University Medical Center who turned out to be the most useful collaborator she'd had since leaving active service, a man named Dr. Sadiq, who spoke in the same compressed, high-information cadence as people who had learned their medicine in environments that didn't reward inefficiency. She trained the ER nursing staff on blast injury patterns and tension pneumothorax recognition, which were skills that most civilian nurses never needed, and some of them would need exactly once in a career, and which, in that one instance, would be the difference between a correct call and a near miss. She wrote a military patient intake protocol that accounted for the particular communication patterns of service members and veterans, the tendency toward understatement, the institutional distrust of medical environments, the specific ways trauma presents differently in people who have spent years learning to suppress its signals. She was not perfect at any of it. The training sessions were sometimes dry, and she was not a natural public speaker in the way that some people are, people who can hold a room with their presence. She had to work at it, which she did, because the work was worth the awkwardness. She made a protocol revision in week 3 that turned out to have a logistical flaw, and she corrected it, without drama, because that was what you did when you found a flaw. Priya became, improbably, someone she ate lunch with most days, which was not the relationship she'd have predicted during week 1, and which she found, without making a large thing of it, valuable. Priya was perceptive and direct, and occasionally said things that made Olivia think about her own patterns in ways she wouldn't have arrived at alone, which was worth more than she had a vocabulary for. She still drove the back roads outside Ashport when she couldn't sleep. She did it less. Whitaker came back to the hospital 3 months after his discharge. Not as a patient. He came for the formal ceremony that the board had organized to mark the implementation of the new trauma readiness protocols, a thing that Olivia had tried to have scaled back to a small departmental meeting and that the board had insisted on making public because the board had understood, in the months since the investigation, that what had happened at Riverbend was a story worth telling correctly. The auditorium on the second floor held 200 people. It was full. There were nurses, physicians, administrative staff, community members, local press. There were 3 veterans advocacy groups who had heard about the case through Whitaker's public statements and had sent representatives. There was a table near the entrance with information about the new veteran care program, and Priya was staffing it with the focused energy of someone who has adopted a cause. Rourke was in the second row in dress uniform, which he probably could have avoided but had chosen not to. Whitaker spoke first. He was on his feet, recovered, moving with the slightly deliberate gait of a man who has learned the lesson of his own body's limits without enjoying the learning. He spoke about what had happened to him, the Hargrove failure, the untreated injury, the morning in the ER, with a directness that had no sentimentality in it, just facts arranged in their correct sequence, which was more powerful than sentiment would have been. Then he talked about what had happened after. He named the investigation. He named the institutions. He named Veritas Partners and the pattern of documentation management that the AG's office had now documented across 6 facilities in 3 states. He spoke carefully. Solis had clearly been involved in the language, but he spoke completely, because a man with his platform speaking completely was the thing that was going to make it harder for this particular architecture of harm to rebuild itself. And then he said Olivia's name. She was in the 3rd row, which she had arranged deliberately, seated between Dr. Sadiq and one of the nurses from her training cohort, a young man named Aaron, who had turned out to have a natural aptitude for trauma assessment and who she was quietly mentoring in the way she'd been mentored at 22 by a ranger medic who'd never made a ceremony of it. When Whitaker said her name, she stood, because that was what the moment required. And she looked at the room full of people looking at her, and she felt the complex and imperfect truth of being seen after a long time of being deliberately not seen. It was not comfortable. She had not spent 8 years in operational environments learning to disappear because she liked the spotlight, but she stood in it because the work deserved to be visible, and the people who had tried to erase it deserved to understand that erasure has a lifespan. Whitaker looked at her from the podium with the expression of a man who has seen a great number of people under a great number of conditions and has made a considered judgment. She never stopped being a medic, he said. She just walked into a building where nobody knew what that meant yet. The room's response was genuine and sustained, and she let it land. Afterward, in the corridor outside the auditorium, while the room was still full of the residue of the event, she found a quiet section of hallway near the stairwell she'd stood in weeks ago when she'd needed 2 deliberate breaths and a moment away from the machinery of what was happening to her. She stood there now, not because she needed to, but because she wanted to mark the distance between those 2 moments in the same location. The difference was not that everything was resolved. Some of it was still in motion, some of it would be in motion for a long time. The investigations and the appeals and the slow work of institutional change that never moved as fast as the harm it was correcting. The difference was that she was no longer moving alone through a building that had decided she was a problem to be managed. She was 31 years old. She had kept a man alive in a trauma bay with the same hands that had done it before, in harder places, under worse conditions. She had not signed the document. She had not taken the exit. She had stayed in the room, in every room, and told the truth in the flat, undecorated way of someone who learned a long time ago that the truth doesn't need help to stand up. She was a floor nurse. She was a trauma and veteran care integration lead. She was an 18 Delta who had spent 8 years learning things that took other people's careers to approximate. She was a woman who still drove back roads when the apartment got too quiet, and who was better at saving strangers than at feeding herself a real breakfast. None of those things were in conflict. They were all just true. Vega came around the corner of the corridor, slightly ahead of Rourke, doing the ranging scan she did in any unfamiliar environment. When she saw Olivia, she came directly to her and sat, without command, and looked up with the patient certainty of an animal that has decided about a person and doesn't need to revisit the decision. Olivia put her hand on the dog's head. "Good girl," she said. Rourke came around the corner and stopped when he saw them. He looked at the dog, at Olivia. He had the expression of a man who was going to say something that mattered and was deciding how. "The IG's office called this morning," he said. "They've identified documentation discrepancies at 3 more Veritas-affiliated facilities. They want a clinical expert to advise on what constitutes an actionable deviation from standard care in the case files." She looked at him. "They asked for you specifically," he said. She looked at Vega. The dog was still watching her with that patient, decisive attention. There were people in the auditorium behind her who had come to recognize something. There were people in 3 states who had finally been able to name a pattern they'd been living inside. There were nurses who had signed documents they should not have signed, and physicians who had nearly missed things they should have caught, and administrators who had built systems designed to protect the institution from the cost of getting it wrong, And the cost of all of that had been paid by patients and staff and anyone who walked into a building trusting that the building was trying to do what it said it was doing. She was tired of the weight of what institutions did when they prioritized their own continuity over the truth. She was not tired of the work. She had never been tired of the work. "Tell them yes," she said. Rourke nodded once. Vega stood, and the three of them walked back toward the auditorium together, and the hallway was ordinary and institutional and lit with the flat fluorescent light of a building that would never be beautiful, and it was exactly where she was supposed to be. The thing about quiet strength is that it doesn't announce itself. It doesn't need to. It's there in the hands that know what to do in the dark, in the voice that says, "Listen again," without raising itself, in the person who stays in the room when every institutional mechanism is telling her the room is not for her. She had been that person her entire adult life. She was still that person. And now, finally, the room knew it too.